trying to get pregnant, but your prolactin level is high. This tiny gland in your brain may be the reason. A pituitary microadenoma may be small, but can completely disrupt ovulation. I had a patient with a prolactin of 66 and pregnancy is not happening. So this case is all about microadenoma and high prolactin level. I'm going to discuss this kind of case and about microadenoma and what to do about it. Hello, everybody. I'm Dr. PK. If you have been told that you have pituitary microadenoma and your prolactin level is 60 plus, in my case, in my patient's case, it is 66, and she's not getting pregnant for last 2 years. She is not on any medication, very young, healthy female. She had one child 6 years ago. Here's the important part right up in front. Yes, this can absolutely affect fertility, but the good news is that this is often a very treatable cause of infertility. A tiny tumor in the pituitary gland, sometimes just a few millimeters, can disturb your hormones enough to stop ovulation, throw off your cycle, and make pregnancy much harder. And many women do not even realize that this is happening until they start trying to conceive. What is pituitary microadenoma? A pituitary microadenoma is a small, benign growth in the pituitary gland. It's only less than 10 millimeter in size. The pituitary gland sits at the base of the brain and controls many important hormones. Some microadenomas produce prolactin, and when prolactin rises, fertility can be affected. So even though the tumor is small, the hormonal effect can be big. So what does a prolactin level of 66 mean in this case? The prolactin level of 66 is above normal and can be high enough to interfere with ovulation. In some women, elevated prolactin can lead to menstrual changes, infertility, and sometimes breast milk leakage, even when a person is not pregnant or breastfeeding. Prolactin affects brain's reproductive signaling. When prolactin goes up, it can suppress the hormone that normally trigger ovulation. That means the ovary may not release an egg regularly or at all. And the Endocrine Society identifies hyperprolactinemia as a cause of infertility, and treatment guidance specifically addresses prolactinoma in patients seeking pregnancies. So a simple way to understand is think of prolactin like a brake pedal on the fertility system. When the prolactin is too high, the body may act like it is not the right time for pregnancy. No egg release means no ovulation. No ovulation means pregnancy becomes very difficult. Now, the question is, can the microadenoma be the reason for infertility? Yes, it can be. A microprolactinoma is a recognized cause of infertility, and treatment with dopamine agonists promptly restores fertility. Some pregnancy guidance notes that treatment restores fertility in the large majority of affected women. But here's the nuance. A prolactin of 66 does not automatically prove pituitary lesion is the only problem. Other things can rise prolactin, including stress, pregnancy, hypothyroidism, kidney problem, certain medicine, especially antidepressants, antipsychotics, opioids, and metoclopramide. In this case, none of that applies. So the MRI matters, but the full hormone workup matters just as much. What symptoms might happen with high prolactin? Irregular period, skipped period, no periods at all, trouble getting pregnant, breast milk leakage, and low libido. Some women have almost no symptoms except infertility. Hyperprolactinemia commonly causes menstrual disturbances and infertility. So what should be checked first? If someone has prolactin level of 66 and a microadenoma, the next step should include repeat prolactin level, check thyroid, review medication, look at the menstrual or ovulation history, and do the rest of fertility workup. Okay? And that can include ovulation assessment, uterine and tubal evaluation, and partner semen analysis. This is where many people get stuck. They focus only on the pituitary and forget that there may be more than one reason pregnancy is not happening. Are they treated? The main treatment of prolactin related infertility is usually a dopamine agonist medication. Most commonly used is cabergoline or sometimes bromocriptine. The Endocrine Society guidelines recommends dopamine agonist for prolactinomas, and cabergoline is widely used to lower prolactin and can shrink the tumor. The goal is here to lower prolactin level, restart normal ovulation, and improve menstrual cycle and improve fertility. In many cases, once prolactin level comes down, ovulation comes back and pregnancy becomes possible. And what happens when the pregnancy occurs? Now, microadenoma generally usually have a much lower risk of enlargement during pregnancy than a large pituitary tumor. An Endocrine Society guideline specifically addresses management of prolactinoma in pregnancy, and pregnancy endocrine guidelines describe microprolactinoma as a low-risk lesions. But once the pregnancy happens, treatment and monitoring are individualized, and that's why the care should be coordinated with an endocrinologist, sometimes a reproductive endocrinologist, and an OB doctor. So bottom line is, if you have pituitary microadenoma prolactin of 66 in my patient's case and difficulty getting pregnant, then yes, elevated prolactin could absolutely be the reason. Why? Because high prolactin will block ovulation. And good news is it's very treatable. And many women are able to conceive once the hormone imbalance is corrected. What are the red flag symptoms? You need urgent evaluation if you have severe headache, vision changes, double vision, fainting, or new neurological symptoms. These are not typical infertility only symptoms and may need faster evaluation. So, if you like the video, please subscribe and repost it and share with somebody who's having difficulty getting pregnant. I'm Dr. PK from Dr. PK Live. Thank you for watching.